Well, good evening, everyone. This is Dr. Ellithorpe, and we are at December 3rd, 2024, here in Tustin Longevity Center. And we are doing our weekly, every Tuesday night, 6 o'clock to 7 o'clock, Ask the Doctor Anything. We bring up preventative, functional medicine approaches to various symptoms and problems. So we invite our patients, family, and friends to go and get on our website so you can type in a question and we'll try and answer them for you. So we'll go through those as we see them. And then we do have the YouTube live so that if you're joining in with us, you can get on YouTube and then type in your questions in a live fashion. So tonight we will be bringing in questions from some that I missed. I couldn't finish up from last Tuesday, and then we'll get the new ones as well. Once again, if you join tlcdoctors.com, you can get on the newsletter and notification. And with that email notification is a link so that you can type up your email questions. And we'll see what we can find to give you an answer. And then if you're YouTube, you can type it in the chat section. We are doing this not to manage you over the YouTube, but to just give educational and information advice as to how we think functionally in healthcare and medicine. Now, the first question comes from Monica, and she put this question out last Tuesday, so hopefully, Monica, you're listening. She says, I'm a 59-year-old female with an autoimmune condition, scleroderma, and currently under a hormone replacement therapy, including estrogen patches. My rheumatologist informed me that estrogen therapy is shown to cause fibrosis. Interstitial lung disease is highly prevalent in scleroderma patients. Is there a natural way to supplement estrogen? Hormone replacement helps me with sleep, headaches, and energy. Well, I'm going to say I've handled many people with scleroderma. This autoimmune phenomena we believe is generated by your gut and leaky gut with perforations from the one cell lining of your gut, from lectins, from the genetically modified wheats, from pasteurized homogenized dairy, from eating the same thing marketed over and over, and that injures your gut lining. Then your immune system is set into alarm, and unfortunately, you can get many autoimmune diseases. Now, we find that there is a type of fibrosis. Usually it's associated, or we see it in the skin, the fingers become very waxy, like the mouth can get scarring and stiff. Every time we have put our scleroderma patients on the gut rehabilitation, a rich phospholipid diet, healthy fats, that would be more like a carnivore diet, putting them on time-restricted eating, adequate hydration, and then especially high-dose vitamin C with EDTA chelation therapy. The microcirculation of the chelation improves all the circulation to every part of the body, from the lung to the fingers to the skin, all over the body. And so our scleroderma patients have done tremendously well and just don't seem to progress and need to go on to medications. So with regard to hormones, I've used those hormones on those patients, every single one of those scleroderma patients. And I found no ill side effect, but rather enhancement of their sense of metabolism, immune function, bone health, mental well-being, Their sleep depth and repair at night while sleeping is very well established. So that's my experience with natural human estradiol hormone replacement with EDTA chelation therapy with high dose vitamin C, with a more rich, healthy fat diet on a more carnivore diet, reducing the inflammation of the gut, calming the body down. We'd be putting you on things like probiotics and enzymes as well, finding out your blood type. But I do not see, nor have I found in my many decades of practice, anything but a benefit from our use of these modalities along with estradiol and progesterone, DHEA, testosterone for our scleroderma patients. Next question is, what are your thoughts? Let me type something in the chat here so people can see it. I'll say hello, TLC Health Freedom Tribe. God bless. That way people can see the chat and that they can type something in. Join us in the chat. All right. Now the next question is from Veronica, and she says, what are your thoughts on infrared PEMF mats? Are they helpful? That's two different things. PEMF means pulse electromagnetic frequency mats. And I have that here in the clinic, and I have for decades. And then there is the infrared mat. And these are a variety of things. Some of the mats have the infrared, which is somewhere between, if I remember, 600 nanograms to maybe 700 nanograms. And then the higher frequencies, 700 to 880 range, it is all about the frequency of the light wave photon. And the 600 will penetrate down to the dermis, to the subcutaneous, whereas the 800 to 880 penetrates down into the muscle. And some of these mats have just one or the other. There are new mats that have them combined, and they pulse them so that you get a deeper penetration. This energy, electromagnetic energy, infrared energy, red light therapy is different than pulse electromagnetic frequency, which is a kind of like an electromagnetic loop. And we have these loops, and you can put it around and it'll stimulate through that magnetic energy field with the loop contraction of your muscles. They're both valuable. They're both helpful in enhancing circulation, enhancing cell detox. Circulation detoxing will promote the nutrient delivery and the waste removal. So they're both very valuable. You know, one wonderful cheap way to do this is to get up in the morning with sunrise, the first hour of morning light, and stand with your feet for 2 to 3 minutes in the wet grass. You'll get the benefit of the earthing or grounding with the earth. You'll get electric discharge of the negative ions, and then the infrared will be penetrating and going through you much more powerfully. It even goes through bone. But these mats are valuable, so yeah, I'm in favor of them all. James says, when your prostate PSA goes from 3.5 to an 8.1 in 6 months, then you take another test a month later, and it's 8.2. So it only went from 8.1 to 8.2. What do you think? All right, so my thought is a rapid rise in a 6-month period of time. It's taught in the standard of medicine to be concerned about cancer of the prostate from such a rise in the PSA from the 3.5 to 8.1. And that degree of rise becomes suspicious. Now, that's why you have to repeat it. And if it hasn't continued to rise, that has some reassuring effect. But I'm not a specialist in urology or oncology. I think what should be asked of you is, had you had any trauma? Were you riding a bicycle before this? Did you have an infection? Did you get any prostatitis infection in the prostate? Various things can raise the prostate uh, acutely like that. So before you jump to say it's a cancer, you certainly need to have these things screened. Very often, your urologist will encourage you not to have sex the day before the lesson, not to ride a bicycle, not to be on any long road trip or plane flight where you're sitting on your prostate, limiting its circulation. And and so there's validity to it. The other thing is, the older you get, the more the prostate will become probably hypertrophied, enlarged. So an enlarged prostate can have a 6 to 8 range. I have several patients who have done that for many, many years. So you need to work this out with your urologist who's checking this and decide whether or not you want to do a prostate biopsy. Maybe your urologist will ask for an MRI of your pelvis to look at the prostate structurally. And if it looks structurally just fine and there's no nodules or lesions, then I think watchful waiting is certainly something to be discussed with your urologist rather than going for needle biopsy. They're usually benign, but I did have a patient die from a needle biopsy from a pelvic infection from the needle biopsy that was done. So there are risks there. So I wouldn't get too excited. It needs to be followed up, and there's other reasons, and explore them. And many times a urologist will put a patient on some antibiotics for a couple of weeks and then retest the PSA. That very often will bring it down, especially if it's caused by some kind of a low-grade infection. Um, we do high dose vitamin C with chelation to improve the circulation. We ask the patients not to eat a high carb diet. That improves the circulation to the prostate. We ask our patients to exercise regularly to help their prostate. We ask our patients to use a high dose systemic enzyme like Vascuzyme or Vitalzyme, Proteozyme. These have proteolytic enzymes, serrapeptase, nanokinase in them, and that will disinflame it. These things are all very, very helpful. And then that's where I would begin, James. We have a live question. Tiziana says, "Hi, Dr. Ellithorpe. What do you think about colostrum supplements to help the immune system?" I'm in favor of them. That's our SBI Protect is serum bovine immunoglobulins that we get from the colostrum of New Zealand. I think it's A2 cows. So I'm very much in favor of that immunoglobulin A that's in the colostrum. So yes, that's very helpful, especially for gut health. Also, are you going to bring back your protein bars? Thank you. Boy, those protein bars look like they got caught up into a bureaucratic hole, and I don't know what to say, Tiziana. I feel very bad about that, and I don't know what to do. I I have no answer. Bureaucracy is what is a problem, and too many fingers in the management, too much bureaucracy ruins everything, even in our own government. It's too big, it ruins it. That's probably what happened to the bar. So don't look for them right now. It is a bureaucratic mess. All right, now the next thing is Krista says, I was wondering your thoughts on drinking celery juice every day and apple cider vinegar every day. Also, do you feel during the flu season it is important to take zinc? Finally, what is your take on vitamins and minerals in a gummy form? Thank you. Well, let's go backwards. Most gummies have high fructose corn syrup or some fructose concentrate from juice in them, and that's extra fructose that is not helpful to the immune system. So gummies are not a way to take your supplements and vitamins. If you're a child, a toddler, I can see doing it, but as adults, we shouldn't. Is it important to take zinc? Well, there is zinc in the TLC Energy Core. I put it in there for the sake that we need an immune system all the days of the year. It is, I think, 6 milligrams if you use that daily. If you were to get a cold, like in the fall, we have the TLC multi minerals that have 25 milligrams of zinc that you can take in the 3 capsules per serving. And so that can boost you, and you could certainly do that together with the TLC Energy Core. But I'm very much in favor of zinc on a multitude of levels. It acts as an antiviral. It's important in vitamin A therapy, thyroid therapy, so many things. So yeah, I think it's very valuable. We could go through every element in the human body, and there's great value in it. So eating meat, fish, chicken, turkey, beef, eggs, they are such a high dense nutrient source for your minerals, essential fats, your B vitamins, vitamin A, vitamin E, vitamin K2, and vitamin D. So we feel very strongly that a richer protein diet with low carb vegetables is the way to go, with limited fruits for that fructose. So did that get that question the way you wanted it? Oh, the apple cider vinegar and celery juice. Well, normally you wouldn't eat that much celery in a single sitting. You take so many stalks of celery to turn it into a juice. That is like pre-digesting it. That's like mobilizing the sugar that would have been much more difficult to digest and be available. Now all that starchy cellulose sugar compilation is much more available. And so you're raising your glucose exposure with it. So I am not in favor of juicing anything. I'm in favor of eating celery, but not juicing celery. And as for apple cider vinegar, a lot of people are not digesting well. If you're nervous and fearful, that stress will diminish your secretion of stomach acids and digestive enzymes. So more and more people are finding that simple tablespoon or two, or a shot or an ounce of apple cider vinegar with a meal greatly helps them digest their foods. So I'm in favor of that. Next one is Debbie says, hi, Dr. Rita. I have a friend who is interested in Juice Plus. Juice Plus has folate in it. My friend has methotetrahydrofolate reductase issues and has to have a methylated version of folate in order to process and absorb it. Is the folate in it methylated version? The answer is yes, resounding, and they've done studies on this. In fact, these studies precede much of the excitement over nutrition from 30 years ago. So yeah, we have seen that methylated format of the Juice Plus fruit, vegetable, and berry concentrate is associated with a nice reduction in homocysteine from all the B methylated products. So the answer is yes. Betty, She says, do you recommend a 73-year-old male switch to a carnivore diet? Overall, health is good, no diabetes, some mild brain processing issues. On a statin for high LDL and lipoprotein little a, has Hashimoto's as well as EOE autoimmune issues. I don't know what EOE is standing for. How would you approach making this determination? I I would never put anyone on a statin. That's how I would approach it because that's associated with cell membrane damage. Every cell membrane has to have cholesterol. We're made up of fats and proteins. So the research on statins is dismal as far as having any significant volume of life expectancy enhancement. We're talking, I don't recall the exact study, but in my lectures that I've sat through on the statin usage, we're talking about someone being on a statin may have increased their life by days, projectedly in large studies. And yet they have the memory issues and they have the nerve cell membrane damage issues. So no, I am not in favor of statin therapy. A wonderful YouTube to watch is a review on these studies that picks up the one I'm referring to. It's called High Cholesterol is Healthy. And that is put out by Dr. Ken Berry and Dr. David Diamond, who's a PhD in this. So the two discuss last year's, all the studies up to last year. So it's a nice review. And you'll see after watching it, it would be an extremely rare person who might value from any statin therapy, but that's extremely rare. The other thing is LDL is good for you. It's not bad for you. LDL is important for being a transport medium to deliver around your CoQ10, your fat-soluble vitamins, the cholesterol, and other parts of fat transport because it's not water-soluble, so it has to have these lipoprotein little boats that it travels through in your body. The problem comes is when you eat such high carbohydrate diet, starches and sugars and fruit sugars, your blood sugar goes up so high in insulin consistently and repeatedly that your body starts getting insulin resistance. And then these turn into fats. So when you take a candy bar, take a teaspoon of sugar, it will immediately, if not burnt up by your activities, will be converted into triglyceride fats. Those fats will flow through and be picked up and transported by this lipoprotein packaging, LDL. And if you keep on feeding yourself all this sugar, starch, bread, pasta, crackers, beans, rice, popcorns, and everything, then you're going to have lots of little LDL particles. So the size will be smaller and the number higher. That's when you get into clear-cut cardiovascular disease. But large, fluffy LDL particles is the way we were designed for our health and to help our bodies. The other thing about LDL cholesterol particles is it is a sink for bad toxins. For instance, in your stomach, you have tons, I mean, literally pounds of bacteria. A lot of them are bad bacteria, and they make endotoxins. And these lipopolysaccharide endotoxins can pass through and leak into our system, which will harm us. And the LDL will suck those up and help our immune system that way. So it's not right to just say LDL is bad. It's not. We make it bad by our lifestyle, eating a high carbohydrate, sugar, high fructose diet. So yeah, I think a carnivore diet, the older you get, is clearly in research the way to go, to switch to eating breakfasts and lunches and to become a weightlifter. And that's where I'm going to go. I'm already in my gym clothes to go to my weightlifting with my husband. All right, hopefully that answers your question, Betty. Helen says, my 19-year-old has amenorrhea, no period, for 7 months. Her blood work shows low estrogen, 16. Yeah, that's very low. Progesterone, less than 0.5. That's very low. I wonder, is she on the birth control pill? Thyroid panel is off too. She has a low T3, high TSH. She can't get in to see a doctor until February 2025. Is there anything we can do to help return menstruation? Is there over-the-counter progesterone? The answer is yes. We carry Kokoro, progesterone balance, progesterone cream, and she can use 2 to 4, even 6 pumps of this. And I would do this, 2 weeks out of the month. So she doesn't have a period. And if I had a young woman without a period, otherwise no other findings, I would have her start using natural progesterone, 2 weeks on and then 2 weeks off. So either decide to use the first 2 weeks of the month or the last 2 weeks of the month, but keep it the same. And I would just rub it on the arms and legs and tummy. That will absorb and that'll start speaking to the body that at least progesterone's normal. She has to have a healthy lifestyle with a good sleep cycle and no staying up watching YouTubes and your cell phone, talking late at night. Try and get morning sunshine, infrared, feet in the wet grass to ground to get circadian rhythm back. She has to be well hydrated in order to menstruate. So half her weight in pounds as ounces of water a day. So if she's 150 pounds, she would need 75 ounces of water every day. And then she should be on a low carbohydrate diet because you only make red blood cells in the membranes out of protein and fat. You don't make it out of fruits and vegetables. So eating a hefty protein diet, healthy fats, meat, fish, chicken, turkey, beef, eating a good, robust breakfast that has breaking the fast with proteins, steak, chicken, fish, pork, eggs, and maybe some vegetables. And use the progesterone like that. And that's the first step that we would do. Marilyn says, I take 10 grams of liposomal vitamin C every morning on an empty stomach. I am persuaded that our bodies can benefit in so many ways with megadosing this vitamin. Any comments? Well, I agree 100%, Marilyn. 10 grams is not a megadose to me, though. A megadose would be something like, 25, 50, 75, 100 grams intravenously. 10 grams orally is quite safe. And compared to the recommended daily allowance, I think it's something like 70 milligrams for a woman, 90 milligrams for a man, is ridiculously low. And many heart disease doctors are starting to argue the point that maybe blood vessel wall injury from high glucose, cytokine storms from a cold or virus, these wouldn't happen if we had higher vitamin C levels, because vitamin C helps to keep the membrane integrity stronger so it won't get a scratch or a blowout puncture in the cell membrane. So, there is a study on Dr. Thomas Levine. He is both a lawyer and a doctor, medical doctor. If you could put in vitamin C, Thomas Levy, Levy. And I think the title is a heart disease is scurvy, okay, which is low vitamin C, or subclinical scurvy, not to the point that you have bleeding gums and your teeth are falling out, but vitamin C is associated with losing your teeth and bleeding, bruising, and so forth. So I would totally embrace 10 grams orally of vitamin C. We have some live questions. Garden Fairy says, YouTube served up a video on topical estriol to me yesterday for facial wrinkles. I use estrogel, but I am tempted to put some of my leftover vaginal cream on my aging face. What do you think? It's a marketing ploy, Garden Fairy. Estriol is never ever seen it make a difference in skin wrinkling. Estriol is usually used on women who have breast cancer, and the doctor feels safe that it won't get absorbed through the skin and the vaginal area, and a woman will get some relief with a topical estriol in that moist area. But the skin on your face is different from the vagina. And so I would only stick with estradiol on my face for um, helping it be with as little wrinkles as possible. And then what else? Carolyn says in the live chat, can you explain again how you use colloidal silver when coming down with a cold and what else you do? Well, I use Argentine silver. This is a nanoparticulate. That doctors only, I guess, get this. Argentine 23 is a nanoparticulate, 23 parts per million. And when it's nanoparticulate, it means it's uniformly dispersed in the water. Colloidal implies a chemistry that is associated with clumps. So you'll have empty zones and then you'll have clumps of the silver molecules. Silver, of course, is well known to be virucidal, bactericidal, and fungicidal. So every night after work, I squirt this up my nose in case I breathed in anything that was unprofitable to me. And then, of course, in the winter, the weather gets dry and the air gets dry. And so you can get a thinner membrane as you age, just like you can get thinner skin with aging. And so moistening your skin in the nose, I squirt this up my nose at nighttime, will help not only cleanse, but it'll help the moisturizing effect as well. The other things I do is I stay well hydrated. I drink, 96 ounces at least water every day. As you can see, I'm going to do my weightlifting and aerobic exercise 3 times a week minimum. I eat a largely carnivore diet with vegetables and some dairy, and I drink coffee. Rare, if ever, will I drink any alcohol. And then I I try to get a good night's sleep so my immune system can recover. And what else? Then I take, of course, my supplements that have zinc in them. The TLC multi-mineral, 25 milligrams of zinc is in that, plus all the other wonderful minerals. I take my Juice Plus. That has so much research showing it builds up the immune system. And on the children's studies, so many families that use Juice Plus for the children, they just don't get the colds and illnesses that their classmates have. So I'm on Juice Plus, the zinc minerals. I take the D. If I'm coming down with a cold or feel ill, I'll stop eating immediately for 24 hours and just drink a little more water. That's so that my entire body's attention is given over to fight whatever infection it has rather than trying to sort out a food chain going down my gut, because a third of your blood supply roughly rushes to your gut after eating. That's another reason why you feel tired after a meal. That blood rushes there to screen and circulate the blood with white blood cells to make sure it doesn't get irritated with any toxin or foreign parasite or bug coming in that the immune system can help care for it. So that's pretty much what I do. The D, the zinc and the minerals, my Juice Plus, fasting if I get ill, Argentine silver. I have liquid Argentine silver and I can take a sip of it and gargle and then I swallow it. But that's pretty much what I do. All right, then the next question we have is from Marilyn, I take, oh, no, I did that, liposomal C. Terry says, do you support the use of sound frequencies while sleeping to heal the body? I am aware of the value of understanding frequency because everything is in vibration. There is nothing that is not vibrating. This desk is vibrating. And if nothing happened, if we sealed this room off and 1,000 years go by and then you come back, you'll see that this desk will be a pile of dust in 1,000 years because the desk is vibrating. It's slowly burning up, touching oxygen in the room. So it's very slowly cooking. So we're all cooking, we're vibrating. So that's why you have to put water in you to slow the rate of the cooking, kind of like our body's oil is water. So you have to do that and drink plenty of it every single day and not lie to yourself saying, well, I had 2, 3 glasses. That's enough. No, it's not enough. You really do need to drink about half your weight as pounds as ounces every day. So a 200-pound man, 100 ounces of water. 150-pound woman, 75 ounces of water. So sound frequencies were vibrating. I too have that concern that I don't want any subliminal messages going into my soul, my mind at night. So I don't trust any of these website music frequencies. I just don't. I do play the Bible, like Ephraim Zimbalist Jr., with the reading the Word of God. And then I do that. And I think sound also is associated with learned behavior. So I grew up in a one-room home, so I could hear my father discussing politics and religion and stuff and science with his friends who came over, because our bed was like just a mattress on a cinder blocks on plywood, maybe 18 feet away in this big basement one room area we were in. So I sleep best when I'm listening to people talking. That's why I really enjoy have the Bible playing at night softly. There are those who were blessed to have their own bedroom and quietness, and they have to have a quiet area to sleep in because that's their learned experience. So it's kind of interesting. Um, I'm in favor of the concept that there are frequencies that are associated with amplifying metabolism and cell function, and that there, in fact, are frequencies that are damaging to cell metabolism. For instance, that I never went to a rock concert all my life. I abhorred the thought of the Beatles and concerts. I've always been odd, a nerd, and dull. And I saw experiments where you could take a egg that's raw and put it in front of those speakers of those music concerts, and the vibration in that egg would literally congeal all the proteins and literally cook the egg, as you might say. Now that's happening to your brain and your cellular tissues with music that's discordant like that. And that was enough for me to see. Of course, my father showed it to me, and he's the one who taught me to abhor rock and concerts and stuff. So, but then there's music that is associated, or sound frequencies that are associated with enhancing metabolism, and it has like the Fibonacci number. The circle within the circle it's always a certain degreed angle, and those sound frequencies uh, enhance the structure of the space and all functions in the space at the same time. So that includes cell function, and these are clear melodies as opposed to discordant sounds. So yeah, I'm all in favor of it, but I don't trust the internet to play something at night and then pass some stupid message to me through a frequency. Gwen says, I'm age 41, and this is the first time that I'm needing reading glasses. What are your suggestions to prolong good vision? Drink water. Basically, your muscles, you have the little muscles in your eyes, ciliary muscles on the inside and the outside. And what they do is they pull and squeeze and pull and squeeze. Your lens gets thicker and shorter and thicker and shorter. And so by doing that, when you look close, your muscles relax. When you look far, it pulls the lens taut, and so you can see in the distance. Those muscles need protein. Those muscles are extremely delicate. They need water, and they need you to try and live a clean life. Having Juice Plus is probably the number one antioxidant. Oxidation cooks your eyeballs. Cataracts is just cooked cornea. And so if you take antioxidants, I'm fortunate in my 70s, I don't have any uh, cataract formation. My eye doctor is very pleased with how I'm aging. But I do have eyeball structure, nearsightedness, farsightedness, and I do need my glasses for that. But don't cook up too quickly. Drink your water. Remember, water is your basting material. And then I take Juice Plus. It's the most proven through research antioxidant that you could take. Second question from Gwen is, I have been prescribed by a TLC doctor a nasal spray to kill off any mold in my sinuses. I'm not sure what these initials stand for, but it is a blend of MUP, that's mupirocin, EDTA, that's a preservative, Gent is gentamicin. And so these are antibiotics, the gentamicin and mupirocin, and these are antibiotics that you're squirting into your nasal mucosa. And she said, when I use it, it makes me feel like my sinuses and eyes a little bit are burning. I'm afraid it'll burn my tissue. Is it working or harming me? Thanks. Well, I use the Argentin, so I know it won't burn or harm anybody. I don't know what your blood type is. I don't know what your blood sugar is. I don't know what your hydration of water is. So all these things make a difference. I would get the Argentine silver over at the shop and use this if you have any concern or if the other one's bugging you. But there's the two kinds of antibiotics because mupirocin really is designed to kill off Staph aureus, which is very prevalent in our tissues and our nasal mucosa. Gentamicin will kill that and other types of bacteria. So that's why they use the two together. It's a very tiny amount, though. Helen says, I have a persistent eyelid twitch for the past 2 months, and it appears to be my eyelid at least. I am a patient of yours, and my blood work was normal at our last visit in June, age 53. What might be the cause of it, and who should I see to evaluate? I have an appointment with the optometrist next week. Would love to have any feedback. Eye twitching is usually from a B vitamin deficiency, and the nerve is more easily irritated. Stress is associated with the manifestation of having more eye twitching. Mineral deficiencies are associated with it, lack of hydration. So I occasionally have that happen to my eyelid. And I will just make sure that I didn't skip or miss any of my methylated B complex. So I would take methylated B complex, 2 or 3 capsules a day, and see if suddenly it stops. If after a week of using it, because it really should stop in a day or two, add in the TLC multimineral. That will help relax it, the magnesium in there, especially, and the potassium in it. And thirdly, please drink your water. If you do all those 3 things and you're still having this eye twitching all the time, please tell me what the feedback is from your eye doctor. And then the next question is Constance. Oh, from what I researched, Parkinson's is not an inherited disease. A doctor diagnosed my brother with this without asking him about alcohol use, diet, exercise, and other lifestyle choices. But they put him on strong medications, which he's now dependent on. Any suggestions? Well, I would find a good functional doctor, Constance, to look at his personal situation, his blood type, what he's willing to improve. Will he come off the alcohol? Will he bring in exercise? Will he take any nutrients to help his antioxidant status to stop the substantia nigrans, which is the brainstem that is losing the melanin in that area, that is the dark area that helps generate dopamine. I mean, he has to be willing to want to do things. And we have seen many people with a very prolonged life, even though they were diagnosed with Parkinson's. So that is the direction that you have to go, is working and finding a good functional doctor who can help him. Mary says, what do you feel is a safe blood pressure for a middle-aged woman at the end of middle age? Does the medical profession become overly concerned about blood pressure in your perspective? The answer is yes. What should be done if diet and exercise and weight loss aren't lowering the blood pressure? Well, the thing is, most doctors don't take the time to say, how many ounces of water are you drinking every day? What time do you go to bed? What time do you get up? Are you exercising? What does your diet consist of? Are you eating late at night? And what is your blood type? These various things are foundational. How often are you moving your bowels? What is your work situation? Are you tense at work? What's your home life situation? Are you stressed there? Are you married? Do you have children? Are you a caregiver? What's the pile of stress in your life? And then working on each of these things from a functional point of view, we would start working on your hydration clearly. We would talk about EDTA chelation for microcirculation, IVs, high dose vitamin C with that. The B vitamins would be given with the IV chelation. Oral supplementation of minerals, the multi-mineral would be given. And then we would ask the person to consider natural hormones, which are very stamina kind of enhancing, energy enhancing, which helps promote exercise and well-being at the same time. If after all those things are worked on over a period of months, then a medication could be considered, and that would be between you and your doctor. My choice is to try and be happy with blood pressures that are hand read, not machine read, because the machines tend to overread the readings. So even your home machine at night, when you check it in your own home, is going to probably be reading on the high end. So I would bring my machine in to your appointment with your doctors to take a blood pressure reading with your machine, and then have it hand read, because typically the machines are overreading it. But what number am I happy with? I'd like to be under 140 systolically and under 90. And then, of course, with a history and family history and other stress assessments, if all those things are well, I'm not going to worry about it. I would try and use the least amount of medication, if at all possible. And the one I would choose depends on the personal history of the person. Others, some I would start with a beta blocker. Some I use a calcium channel blocker. But it really has found to be dependent on their home life, blood type, situation is all unique. And I see tendencies for improvements based on your blood type as well. All right, let's see. John says, as you know, androgen deprivation therapy helps some patients keep prostate cancer in check. Do you see any negative about decreasing testosterone so low, albeit only temporarily? I would suppose a temporary drop in your testosterone wouldn't be bad, but when men have low testosterone continuously, their mood, their affect, their muscle mass, their immune system, their bone health all goes into decline. So I am not in favor of reducing testosterone or hormones whenever I possibly can avoid doing that. George says, hi, Dr. E. With all the hype of taking salts, electrolytes, which do you consider the best? Some take the iodine out. Baja salt, endorsed by Becca Celtic, now shows heavy metals. And if I may ask, how much should a human take? And if we take salt daily, do we need half our weight in water, or is 64 ounces enough? And adding what we lose in perspiration. George, in general, I am in favor of 2 grams to 3 grams of sodium per day, especially because I ask my patients to drink half their weight as pounds as ounces of water every day. And the salt type, at some point we have to walk in faith. You get on the highway and you're going to drive and you pray that a tree won't fall into the road, or someone texting on their phone won't cross the center line and hit you head on. So life is like that. The same with these salts. You've got to just try and pick a salt that is mined from deep within the earth, so that particulate contaminants on the top surface of the soil aren't landing on it from pollution. So I like salts that are mined. And you can go on the internet and look for salt that is mined. These are usually colored salts because of the minerals deep in the earth mining for them. Is Celtic salt mined? I don't know. What did I last buy? I was in a compromised situation, busy, and I went to Sprouts and I bought their what do you call it? Himalayan salt, pink salt. So I bought the big grinder where you grind it. I didn't look into it. I didn't study the manufacturer. I can't stress over everything. So I think it's better to try and get something like a Himalayan salt than something from Morton's production that is going to be just that granular without iodine. I like it with the iodine, but I don't worry about it because I take iodine tablets separately, 12.5 milligrams every day. So I'm not an expert in that, but I do know that I don't want it from the top surface of the earth where all the contaminants fall in. I want deep earth mine salt. And then Andrea says, I'm reading Dr. Ornish's book, a big proponent of plant-based diet. And he says diets high in animal proteins increase interleukins and IGF-1 that promote chronic inflammation. As you promote the carnivore diet, what are your thoughts about this? Well, I could show you the same science that says a high plant-based diet is also showing increased interleukins and IGF-1. It all depends on what the person is really doing. If someone is on the Dean Ornish diet and they are in fact truly just having cabbage and broccoli and asparagus and green beans and Brussels sprouts and berries and tangerines and olives and avocados, the likelihood of them building up enough carbohydrate to generate the inflammation is going to be lower. That would also be associated with the type of diets that he promoted that did show the cardiovascular benefits. But most people will fudge and excuse themselves. We aren't honest with ourselves, and these people will say, "Well, I'm not eating meat," as they eat their tortilla chips, or "I'm not eating chicken or pork," as they eat their um, oatmeal with sugar and cinnamon on it. So you see, everything is very difficult in food studies uh, to get down to the T, because we rely on these forms about what we ate. We can't really remember. So, epidemiological food studies and outcome studies are really grade C level science. And there's as much inflammation in the high starch, carbohydrate, fruit, sugar diet as you'll find in someone who says they're a carnivore, but they're eating a cow that was fed on a bunch of grain to fatten them up quickly, because carbs make you fat through inflammation. Then that meat is less ideal. And they may also eat potatoes with it and have pie, So uh, diet is a revealer of truth. So if you get your lab done and your insulin isn't fasting around a 4, if your blood sugar isn't about 85 fasting, if your hemoglobin A1C isn't about a 5.3 or less, if your triglycerides don't equal to your high density lipoprotein HDL, so that'd be roughly in the 50 range, then you're going to have inflammation, and you're eating either food reactive materials, too many carbs, you're not exercising enough, your muscle mass is wasting away, and you can't keep up with what good carbs you do eat. I mean, life is a motion picture. It's hard to take a snapshot and apply it to every human being. So please understand that the Dean Ornish book, uh, the carbohydrates and starches complex, if you do an absolute pure complex, which I really don't think anybody does, they're going to get high inflammatory markers just from the carbohydrate level. And then you'll say the same with animal products. If they are fed the grains and they're excusing their cooked yam, cooked peas, corn, and carrots, their cooked potatoes, and thinking that they're doing themselves a service. So that's the last question I have there. I got through them all night. There's another question here. Brigitte says, "Hi, Dr. E. Anything I can do for sciatica nerve pain? My right leg is hurting from the lower back all the way down to my foot. I'm 61. I do not have any other medical issues and not overweight." Um, First of all, hydrate. Try and drink half your weight as pounds as ounces every single day. Then get some systemic enzymes. That's what I give to all my sciatica patients. A high enzyme twice, maybe 3 times a day, like Vitalzyme, 5 in the morning, five, an hour before lunch or two, and then 5 before bedtime. And then that will disinflame your body and give relief. Then you have to do the weight training muscle for your posture. Then you have to do the stretching. And find a good functional doctor who will help you do those physical therapy and then exercise the rest of your life. Stay hydrated, stay on enzymes, and eat the protein so you can build up your muscle mass to hold your skeleton up. And if necessary, you'll have to see, if that doesn't help, a orthopedic doctor and get some x-rays and physical therapy. Hopefully that helps. Suzanne says, my mom is 94. She had a mild heart attack years ago and has a stent and pacemaker. She has diabetes controlled with diet on 2 blood pressure meds and atorvastatin. I'm concerned with her memory. Should I take her off the statin? Well, I'm not her doctor, and I'm not going to say for you to treat your mom over the YouTube. I would never have my mother on statins, especially uh, thinking that that's going to make any difference in her longevity at this point in her life at age 94. But it may have a difference on her memory and her enjoyment of the time that she has left. So uh, find a good functional doctor. Watch the YouTube. High cholesterol is healthy. Keep her on a healthy, low carb diet. Get her exercising as much as possible and drinking her water. If your functional doctor has chelation therapy, help her get some chelation IVs and go from there. And then watch the video, high cholesterol is healthy, and make your own decision and take responsibility for it on just stopping the statin. Discuss it with her doctor and your reasons for your concerns and why you plan to stop it or not. The next question is, hello, Dr. Ellithorpe. What is the best way to improve iron levels associated with anemia? How do you know if you need to focus on ferritin or another process? Helen, I would need to know your blood type. A's are notoriously the worst with digestion and absorbing minerals. They don't make enough stomach acid. So the best way is to find a good functional doctor who will find out what your blood type is. If you're an A, you need digestive enzymes with betaine hydrochloric acid with every meal you eat. And that'll help you tolerate digesting meats and pork and chicken and ham and eggs better, because often people don't like eating these meats and things because they can't digest them well. But if you take them with a digestive enzyme, that should help with your protein and your mineral absorption, because proteins, meat, fish, chicken, turkey, beef, eggs, they're also rich in minerals that are the best way to absorb your iron, not through taking a tablet. But we have the Hemovite here, and that is a mineral chelated iron that is usually very helpful. But that's where I would start, Helen. And then finally, we'll do Jenna here. She says, is the best CRP for blood work the best one to test for inflammation level in your body? Well, it is more reflective of your cardiovascular blood vessels. It is more specific to your blood vessels, whereas sedimentation rate, the erythrocyte or ESR, is for general inflammation. So it really depends. I do both with my patients. So there you go. I meant Brigitte above. Okay. I'm not sure what you meant by that, Jenna. Let's see. Let me go to your question. Well, I still don't understand it, Jenna. But anyway, they're both unique. So whether it's CRP or sedimentation rate, they're both valuable. And with that, I think I'll end tonight, and I'll go to the gym and do my workout and try and live the life I'm asking you guys to live. So the Lord bless and keep you. I pray you all had a wonderful Thanksgiving, and we have so much to be thankful for. And when I think nasty thoughts, I try to stop them and bring every thought into subjection to my Lord Jesus Christ and put a positive thought in its place. So please try and think all of the good things about people and situations. I really think YouTube can be very valuable when we see what blessings we have here in America. So let's be blessed and kind to one another. All right. Take care. Good night.